I'm Allen Cheng. I'm an infectious diseases physician here at Alfred Health, and I'm here to answer some of the questions that junior doctors have about COVID-19. It's a respiratory tract infection. Most, but not all people have fever, and some people have fever alone. But it is generally like an influenza-like illness. So a respiratory tract infection, either sore throat or cough, sometimes shortness of breath, and that's generally the picture. At the moment, there are three groups of people that we're interested in, and each of them have a different level of severity based on how likely it is. So at the moment, the biggest group are people that have recently travelled or have had contact with a confirmed case. And in that group, either fever or respiratory tract infection symptoms, we want to test those people. The next group up is people that are healthcare workers, so like you and me. If you have an influenza-like illness and that's fever and respiratory tract infection, then you should be tested for COVID-19, and that's even if you haven't travelled. And then the third bar is people that have had that haven't got any other risk factors, and members of the general public that come into hospital and need to go to intensive care with pneumonia. And that's the purpose of that is to try and keep an eye on what might be going on out in the community. We recognise that these are things that are going to change very quickly. So next week, this definition may well be out of date, but at the moment, these are the criteria that we're using to test. There's a couple of guidelines. So the one at Alfred Health is on prompt. The Department of Health and Human Services have a very extensive website with lots of information for the public and for health professionals. If you go to their COVID website, there's a section for health professionals. And then the national guideline is at health.gov.au, and there's also similar national guidelines. And although they're not always exactly the same, they're generally pretty similar. We're following the Alfred Health guidelines at this stage. Please look very hard to see if your question's in there or there's something that you can do to find it. But we have covered a few more things in the Alfred Health guideline. But there's a couple of people that you can call on to help: our friendly infectious diseases registrars or infection prevention. If you've swabbed a patient because you think they might have COVID-19, then they need to be treated as if they have until we can exclude it. And that sometimes 2 swabs or sometimes 1 swab, depending on the clinical situation. And that means that the patient needs to be in a single room with droplet precautions. And droplet precautions, I mean a surgical mask, not an N95 mask, and then the usual eye protection, gloves and gown, and then the usual attention to hand hygiene. At the moment, just for convenience, we're putting a lot of people with COVID into neg vent room, but strictly that's not required. And if we fill up with patients, obviously that may change. Airborne precautions, so that's using an N95 mask, is needed for people that are intensive care. We are very sick with COVID-19 because they have a higher viral load. And then what we call aerosol generating procedures. So that's basically intubation or bronchoscopy and a few other procedures similar to that also require airborne precautions. If you've got a patient in hospital with pneumonia and you can't find what is the cause of their pneumonia, you need 2 swabs. If after the first swab you found a reason for the pneumonia, like pneumococcal pneumonia, then 1 swab is sufficient. This is changing every day, but generally about 24 to 48 hours. We're trying to prioritise swabs for inpatients to make sure that we can get them out of isolation as soon as we can. In general, there isn't anything we can do to try and hurry results along. Vidril are getting about 3,000 swabs a day, and as you can imagine, it's pretty hard to find an individual swab inside that box to hurry it along. The results are released on Power Chart. We also get a feed of the results in infection prevention. So if there's a particular patient where it's not on Power Chart and you're a bit worried about the result, you can give infection prevention a call as well. This is a common question that we're asked about healthcare workers who are ill themselves. So if you come back from overseas, well, you shouldn't be at work for 14 days. So that's the first rule. If you've been in contact with a confirmed case of COVID, then you shouldn't be at work, whether you have a cold or not. If you're unwell, it really depends on whether you have a fever as part of that illness. So if you have a fever and respiratory tract infections, then respiratory tract symptoms, then you should get tested and go home. If you don't have a fever and you have respiratory tract symptoms, then you can continue to work, but you probably should let your manager know just to make sure that that's okay. If someone in your household has been swabbed, then you're officially not a contact unless that person is confirmed. So you can continue to come to work. Obviously, the usual things apply. If you have a fever or if you're unwell, then please call ahead. But if there's someone in your household that that's only a suspected case, then there's nothing special required of you. I think this is something that a lot of us are facing as healthcare professionals. Everyone is looking to you as a resource. It's important that you keep up to date, and by up to date I don't mean getting your news from social media. So health.gov.au, following the Department of Health and Human Services websites, and obviously what information you can get from Alfred Health is quite important. So make sure that you get credible news and inform people accordingly. There is a hotline that people can call if they're worried they've got COVID or want to find out any more information, and that number is at the top of the screen. In general, we try and discourage that because both of those are generally regarded as what we call aerosol generating procedures, and therefore we would need to put them in a negative pressure room and use airborne precautions. Obviously, it does depend on the state of the patient, and if they need it, then we can accommodate that, but that's something to discuss with the respiratory unit, obviously. A pandemic plan is being developed by the hospital and the state, and there is actually a national plan as well that's publicly available. The pandemic plan actually is on prompt at the moment, but more details of this will be released over the next couple of days and to the next week or so. In terms of training requirements, I think the college are going to be very understanding of trainees in this time. Obviously, people that may lose some experience in some specialties are going to be learning a lot of public health and a lot of respiratory medicine in the coming weeks. So I think it'll be important to be keeping in touch with the college. If you're well, there's nothing special that you need to do except to follow the instructions of the government about what's called social distancing, or what I prefer to call physical distancing or healthy spacing. And it's probably not the time to be going to restaurants and nightclubs at the moment, but obviously try and maintain some social supports with friends and family to get you through obviously an anxious time. If you're unwell, then self-isolation is a different matter. That means staying at home, getting friends or family to try and deliver you groceries without actually coming in and putting themselves at risk. But that's a matter for if you're actually unwell and need to go into isolation yourself. Thanks for taking the time to watch this video to keep yourself informed. I'm sure you're going to have a lot more questions. If you do, shoot our Friendly Infectious Diseases registrars an email, and we'll try and compile a list of questions for a future episode.